Do freedivers really need to learn anatomy? Absolutely yes, because even 10 meters dive means that pressure around you doubles and your skull is full of air-filled spaces, and all of these spaces need to be equalized. If not, you just can't go deeper and start to feel pressure, pain, or sometimes serious issues can start to build up. I'm sure every freediver has faced some sinus pressure or equalization issues caused by the nose. So today we figure out why it's all happened, how it's all connected, and what you can do to fix it. Inside your nose, everything is pretty logical. Right in the middle, the septum. It divides your nose into two sides and helps create a smooth, even airflow. The septum is rarely perfectly straight. Most people have it deviated to one side, but if deviation is strong, the airflow may become uneven, which can lead to stagnation in your sinuses or problems equalizing one ear. On the sides that turbinates, they are like teeny heaters and humidifiers, warming, moisturizing, and filtering the air you breathe. Each turbinate is full of blood vessels, so when you get cold or allergies, they swell up like a gym bro in an arm day, blocking your sinuses and make your equalization harder. We will come back here soon. So, our sinuses, you have two above your eyes, two below your eyes, two behind your nose, and one deep inside your head. So basically, your head is full of air pockets. And this sinus is connected to your nose through super narrow tunnels called ostia, only 1 till 5 millimeters wide. Normally, they stay open and let the air circulate and warm up. And that's why, unlike ears, you don't need to equalize your sinuses actively. But when these teeny tunnels get blocked, the air gets trapped inside and you start to feel pressure when you dive. At the very back of your nose, you will find the station tubes, the one that connect your nose with middle ear. When you equalize, air passes through them. That's what protects your eardrums. Normally, they stay closed to keep out infections and your own internal body sounds. That's why freedivers need to actively open them when descending to push air into the ears. So now let's move to practical part. Let's go through few real situations that every freediver and diver can face, and we will see how this whole system works together. There is two most common scenarios which freedivers and divers face. First, diving with a slightly congested nose, and diving when your nose feels perfectly clear but pressure inside the sinuses still builds up underwater. First scenario, you dive with mild nasal congestion. Allergy, cold or runny nose. During a cold or allergy, the turbinates inside your nose become enlarged and the mucosa covering them swells. Mucus production also increases, and that combination makes equalization much harder even on land, because the station tubes get blocked by swelling or excess mucus, and the air can't pass through easily. And since the sinus opening, the ostia, is extremely small, they can easily also get blocked and you start to feel pressure in your forehead or under your eyes. That's exactly why diving or freediving with a cold is strongly discouraged, because it increases the risk of barotrauma and can push infections from your nose into the ear during forceful equalization. And the second scenario, you feel healthy and your nose is clear on land, but underwater you feel pressure in your sinuses. And I found three main reasons for this. The first is individual anatomy, especially with frontal sinus here in your forehead, because the opening of this sinus is really deep and narrow, so even slight mucosal swelling can lead to blockage of this sinus. And naturally, after 5 or 6 dives, your nasal mucosa swell a bit, and it could be enough for some people to get air trapped inside, and this pressure builds up. The second reason is irritation of nasal lining. Salt water that entering your nose can irritate nasal lining, and it can cause swelling and possible blockage of your sinuses or eustachian tubes. That's why a good fitting mask that keeps water out is so important. And also, freedivers often breathe through their mouth for a long time, but the mucus constantly forms inside your nose and sinuses. And mouth breathing just slows its drainage. And that mucus builds up can also block the sinuses or eustachian tubes. In that case, take off your mask, blow your nose gently, and breathe through your nose for a few minutes to restore mucus flow. And reason number 3, chronic or structural problems. If you have chronic sinus inflammation or deviated septum or anatomical narrowing, It all makes you more prone to sinus pressure during dives. The nose looks small, but it plays a huge role in freediving safety. Equalize smart, dive safe, and if you want to learn freediving from medical perspective, don't forget to follow this channel.